So let's study the dose-dependent effects of the drug dopamine. The drug dopamine has different effects depending upon the concentration of the drug in the body, which in turn depends on the infusion rate of the drug. So here I have written the word dopamine and you can see different infusion rates on the top. The first letter of the word dopamine is D and the infusion rate is 0 to 2. So when dopamine is given at a rate of 0 to 2 micrograms per kg per minute, it acts predominantly on D1 and D2 receptors. These receptors, they increase the blood flow in the mesenteric and the renal blood vessels, which will lead to increased renal blood flow and increased urine output. Then we have the letter P. It kind of looks like the alphabet beta, right? So when dopamine is infused at a rate of 2 to 5 micrograms per kg per minute, it acts predominantly on beta 1 receptors. So these receptors, that is beta 1 receptors, they're mainly in the heart. So when dopamine is infused at a rate of 2 to 5 micrograms per kg per minute, they act mainly on beta 1 receptors which are in the heart, which can lead to cardiac stimulation, so which can increase the contractility of the heart. So lastly we have the letter A here, which stands for alpha. So when dopamine is infused at a very high rate of 5 to 15 micrograms per kg per minute, it acts mainly on the alpha 1 receptors. And alpha 1 receptors, we all know they are present in the blood vessels mainly, and they cause vasoconstriction, increasing the BP. So dopamine at the rate of 0 to 2, they cause increased renal blood flow and increased urine output. At 2 to 5, they cause cardiac stimulation. At 5 to 15, they cause vasoconstriction.